Hello, dear friends and colleagues. Today I'm talking about another important topic which is very common in exam, though it is rare in practicing life. This topic examiner like most because um, they know the weak point of candidate. Candidate don't like to study this topic. This is multiple endocrine neoplasia syndrome. It is a little complicated and confusing. For that reason, candidate uh, usually don't find interest to study this. I'd like to simplify this. Just watch my video. Within a few minutes, it will be very clear, and I think you can get one question from here, and I think you can solve this problem also. You can answer properly. So multiple endocrine neoplasia syndrome, by the name you can guess that is endocrine tumors in multiple area of the body. Okay, and it is familial, and it inherited autosomal dominantly. That is, it is autosomal dominant disease. There will be family history. Patient will present the combinations of symptoms of different endocrine tumor and different endocrine symptoms. So main type 1 and main type 2. Main type 2 again divided into main type 2A and main type 2B. So main type 1, just remember 3P, PPP. First P for pituitary tumor, second P for parathyroid hyperplasia, and third P for pancreatic tumor. Let's go for main 2, main 2A and 2B. In main 2A and 2B, there are common tumors in thyroid gland and parathyroid gland, thyroid gland and adrenal gland. So main 2A is 2P 1M. Just deduct 1P from main 1, 2P, and add 1M. 1P for parathyroid hyperplasia, another P for pheochromocytoma, and M for medullary thyroid cell carcinoma. Okay, and main 2B, again deduct 1P. So 1P you have to remain 1P, and 2M, add 1M extra. So for main 2B, 1P, 2M. 1P is pheochromocytoma, 1M is medullary thyroid cell carcinoma, and another M is marfanoid habitus and or mucosal neuroma. Okay, so for main 1, 3P, main 2A, 2P, 1M, and main 2B, 1P, 2M. Remember, the main 2A and 2B, pheochromocytoma and medullary thyroid cell carcinoma are common. Only difference, main 2A, parathyroid hyperplasia, and main 2B, there is no parathyroid hyperplasia. Instead, 1M more, that is marfanoid habitus and mucosal neuroma. So when you will find the sign symptoms of different endocrine tumor, just you categorize whether it is main 1 or main 2. If main 2, main 2A or main 2B, there will be question here. because they will give some combination of different sign symptoms of different endocrine neoplasia tumor, and you have to find out what symptoms for what tumor and whether it is MEN 1, MEN 2A or MEN 2B. Okay, just I'm talking about that a little more. So just what pituitary tumor, it is in the main, so I'd like to discuss main little details. MEN 1, it is also known as Warmer syndrome, hot. Okay, Warmer syndrome, it is autosomal dominant, and mutation, gene mutation is very simple, MEN 1 gene. So there will be mutation in MEN 1 gene. So MEN 1 gene can give rise this tumor production in pituitary gland, parathyroid hyperplasia, and pancreatic gland. In pituitary gland, there are a lot of tumor, different types of tumor. So what type of tumors can be in pituitary gland? Most common tumor is prolactinoma. Second most, that is somatotroph cell, the growth hormone releasing tumor, and others are rare. So just remember, patient may present with either sign symptoms of prolactinoma or sign symptoms of growth hormone excess, that means acromegaly. And as this tumor is macroadenoma, you will get sign symptoms of optic chiasma compression symptoms or pace occupying lesion, that increase intracranial pressure symptoms. Okay, so patient may present with headache and bitemporal hemianopia, or with the symptoms of acromegaly or prolactinoma. So in scenario, in MEN 1, they may give the symptoms of acromegaly, they'll give the symptoms of prolactinoma, or they may give the symptoms of space occupying lesion, bitemporal hemianopia, like that. Second, parathyroid hyperplasia. So you will get more calcium in the blood. So more calcium, hypercalcemia, you will get symptoms of hypercalcemia. Hypercalcemia symptoms, I'd like to say some, that is, if you just remember, polydipsia, polyuria, constipation, abdominal pain, depression. So just remember, joint pain. These are the symptoms a patient will complain if there is hypercalcemia. Now, in pancreatic tumor, most common tumor is gastrinoma. Second most common, insulinoma. Other tumor, VIPoma, or other lot of tumors are there. Don't remember this. Only remember gastrinoma, insulinoma, or VIPoma. Okay. So if there is gastrinoma, gastrin secretion will be more. Patient will present with the symptoms of Zollinger-Ellison syndrome. That is ulcers in the stomach, intestine, small intestine, and with different parts of the gastrointestinal tract. So patient may complain of abdominal pain and ulcer. If insulinoma, patient may present with the symptoms of hypoglycemia and will get more insulin and C-peptide. Okay. Another tumor can be in pancreas, gastrinoma. That is glucagonoma. So glucagon synthesis can be done. In that case, patient may have some symptoms of diabetes. Okay. So these three types of tumor combination, if you will get the symptoms of acromegaly, symptoms of hypercalcemia, symptoms of gastrinoma, symptoms gastrin secretion, that is Zollinger-Ellison syndrome, or symptoms of insulinoma, that is hypoglycemic attack, you have to think multiple endocrine neoplasia type 1. Now I'm just going to discuss about type 2A. Type 2A, parathyroid hyperplasia. So already I discussed about parathyroid hyperplasia, that is it secrete more calcium and you'll get symptoms of hypercalcemia. Second, pheochromocytoma. I discussed my previous lecture about pheochromocytoma. So symptoms will be P, pain for headache, another P, pressure, fluctuating pressure, hypertension can be there, another P for palpitation, perspiration, another P, that excessive sweating, another P for panic attack or restless, and last P is failure. So patient may present with pheochromocytoma with following what I mentioned, these symptoms. So you will get symptoms of hypercalcemia, symptoms of pheochromocytoma, and history of thyroid medullary thyroid carcinoma. That is, patient will have the symptoms of thyroid tumors in the early age, thyroid cancer in the early age, family history of thyroidectomy, prophylactic thyroidectomy. So if there is this combination, you have to say that this patient might have MEN 2A. Come to MEN type 2B. MEN type 2B, the two are common. Thyroid medullary cell carcinoma and pheochromocytoma will be common. So you will get symptoms of pheochromocytoma, which I discussed. Patient will have operation or thyroidectomy in the early age. At the same time, patient will be tall, slender, high arch palate, marfanoid habitus, or some mucosal neuroma in the tongue and different part of the body. So it is type 2B. Now, how will differentiate between type 2A and type 2B? Type 2A, patient will not have marfanoid habitus, but rather patient will have symptoms of hypercalcemia, thyroid carcinoma, and pheochromocytoma. 2B, marfanoid habitus, pheochromocytoma, and thyroid carcinoma. So if I summarize according to the scenario, then we can say that if patient is having 3P MEN 1, 2P 1M MEN 2A, 1P 2M MEN 2B, okay, symptom how will actually examiner test your ability to differentiate between three. Okay, so for example, patient is having symptoms of hypercalcemia, hypertension, bitemporal hemianopia, diabetes. You have to think MEN 1, because bitemporal hemianopia can only be present in pituitary tumors, so it is not included in 2A or 2B. Now, patient is having hypercalcemia, hypertension. In case of MEN 1, there is a sense of hypertension because the patient is having acromegaly. Acromegaly may be associated with the hypertension. MEN 2B and A also is having hypertension because patient is having pheochromocytoma. So hypertension will be common it can be common in three type: MEN 1, MEN 2A, and 2B. How will differentiate? Patient may give clue that he is having thyroid surgery, was having thyroid surgery in his early life. That is, it is MEN 2A or MEN 2B. Now differentiate whether MEN 2A or 2B. See whether he has got marfanoid habitus or not. Marfanoid habitus or mucosal neuroma, MEN 2B. If he is not having these symptoms, only symptoms of hypercalcemia, pheochromocytoma and thyroid surgery, then it is MEN 2A. Easy. Okay, some question can be uh, asked. What type of mutation in MEN 2A and B? That is rate proto-oncogene mutation, and then chromosome is in the 10, number 10. Rate proto-oncogene, because thyroid carcinoma is associated with rate proto-oncogene mutation. And type 1 MEN 1, there is mutation in MEN 1 gene, and it is in the 11th chromosome. Okay, so I think it is all about MEN syndrome. I think if you remember all these things and just deduct and add, just analysis the symptoms, what tumor can be, and what can be the symptoms of that tumor, then by exclusion and adding you can reach the diagnosis, whether it is MEN 1 or MEN 2A or MEN 2B, and it is the area your knowledge will be tested, and you will get at least one questions, and without one question you probably will not pass the MRCP or any entrance examination, because in every examination in different way they will test your knowledge about MEN syndrome, though it is rare practically. Okay, my next video will be on polyarteritis nodosa, another hot topic. Just stay with me, subscribe my channel. I'll be with you very soon. Thank you very much.